everyone, Nicole from Allure. We are going to do a Cellfina treatment. Cellfina is the only FDA approved device out there to treat cellulite. It has a 96% approval or satisfaction rate at the 2-year mark. So the patients that we've been doing here have been very happy. We have a patient here today who is actually going to do a second treatment because she was so happy with the first results. She just wants to see if she can get it a little bit more smoother. So we've already pre-marked our patient, and that's very important. If you don't know how to mark, I would advise you to go into the training center and the Cellfina portal and really watch how to mark the patient appropriately, as well as having your camera settings appropriate too, and the downward lighting so that you get the best angle of the dimples. So Cellfina is actually going to target the dimples that we see in the buttocks and thighs. There's a fibrous connective tissue band that is actually pulling the skin down, and that gets that dimple formation. With the Cellfina system, we use a microblade to actually go in at a specific depth and cut that band, and that allows the tissue to retract, and your body just kind of takes over and fills everything in. We're going to get her ready. We're going to cleanse the area and start to get her numb, and we'll show you that here in a minute. So what I'm doing now is making a little tumescent skin wheel, because after I do this, I will actually use my needle to tumesce the tissue underneath, so that when we do actually cut the connective tissue band, she won't feel it. This is the most uncomfortable part for the patient. It does burn and pinch, but this is just about the only painful portion that they'll feel. I just like to make a few different skin wheels because I may decide to come in at a different angle with my tumescent needle. Doing okay? Mm-hmm. Okay. Some spots hurt a little bit more than others. Mm-hmm. Now the Cellfina system, they have their own way of tumescing. They actually have a track. Kayla, I don't know if you could show that to... So if you look at the track, you would actually bring your tumescing needle down each track and inject the anesthesia. We found it to take quite a bit of time, and since we are so adept to numbing with our vein procedures, we decided to use that technique, and patients actually have done really well and tolerated that. Mm-hmm. Okay, I'm going to come to this side and just put the little skin wheels in, and then we'll start numbing up that other side, okay? Is that okay? Mm-hmm. Okay. Sorry.
You're going to start on the right side.
Yeah.
Or you can cut it out, right?
Okay, so we're going to start to get her numb. So she will feel this, but I'm going to enter in where I did my little skin wheel so she won't feel that initial poke. And most patients describe this as a burning, tight sensation too. You can see the skin kind of getting like an orange peel-like appearance. Sorry. This is the worst part though. If you can get through this, then you're good. I'm able to actually get some of the area over here too. Sorry, I know.
So you're just going in with the tumescent where you...
Yeah. Just surrounding that area.
Okay.
And you can see, like, where it's numbing, you can see it
It will
blanching.
blanch. It's just a very uncomfortable feeling for the patients, but this is about the
That's
worst that it gets. Did we offer you a squeezy ball? Because we should have.
I'm
We
fine.
can get you one. You forgot about this, didn't you?
It's like having a baby, you forget.
Yes.
Oh, I thought you meant it feels like having a baby. I was like,
No.
oh, jeez, I
No,
hope it's not that
I
painful
hope
for
not.
you. Actually, having a baby really wasn't that painful for me.
No?
When people say, oh, if you did childbirth, you can do anything, I'm like, I don't know about that. I was numb from the waist down, so.
Yeah. How you doing?
Okay.
Are you breathing?
Oh, yeah, that's right. Breathe.
Breathe.
I feel like this is worse.
All right. So I think we're good on this side. Can you clamp that for me? And then, if you wouldn't mind, can you hand me the Cellfina system? Just the track. It's nice to kind of figure out how you're going to go about your plan of attack, per se. Because you want to preserve as much tissue as you can. All
Do
right.
you need more?
Nope, it should be good.
Seems like it's a
So
shorter
I'm gonna, yeah.
tube for some reason. These are the new ones.
This way, this way. Okay, so Kayla, when I start, I'm gonna come in this way first for this first one, and this one, because then, yep. Let me see that photo.
Yeah.
It's always good to have your photos with you too, so you can see. And then I'm gonna do these two together.
These two.
Yep. This is gonna be at the 10, and then we'll come down this way. Okay, perfect.
Is this the only 10?
Mm-hmm. So I'm trying to pre-plan everything because you want to preserve as much tissue as you can. There is one dimple here that we are going to go at a deeper depth, the 10 millimeter depth mark, and see if we can get that dimple to pop out better. When you're trying to figure out your plan and you're trying to preserve the tissue, you want to then angle your guiding platform in different directions so that you aren't going at the same plane all the time and cutting, or in the same direction and cutting. So we're just gonna let her get numb. And when I put this guide platform on, I'll show you, can you see that, Megan?
Mhm.
I'll put it on here. We actually are going to, there's a vacuum suction, so you're going to put it on and then press the vacuum suction, and I don't know if you can zoom in, you can see the tissue gets pulled up into the platform. So sometimes they'll have little ring marks from the suction, but this allows me to have all the tissue retracted, and I'm able to then go in and cut. Can you go ahead and turn it off?
Is a 40?
You want it about 30, so we can turn it down a little.
Okay. Did it seem like it was sucking good?
Yeah,
Okay.
it did. She's got a nice mark here.
Oh, good.
You feeling numb?
Mm-hmm.
Why don't we go ahead and numb up the other side too? So Megan, you can probably turn it off now, and then we'll just numb up this side.
Here's this.
So now that she's numb, we're going to start to cut these bands. So I have my guided platform. I'm using the teardrop shape because she doesn't have any really wide clusters of dimples. We can do that. When I turn this on, I always warn the patients. It is loud. It kind of sounds like a turkey carver, so that they're aware, because sometimes just noise can startle people. But I previously decided my plan of attack, and that's not really the best term to say, a plan of attack, but my plan, how I'm going to best preserve everything. So I'm going to put it on. I don't know if you can see that, Megan.
Yeah.
I have this dimple marked, kind of centered in this. It kind of looks like a baseball, the home plate of baseball, centered in there. And I'm going to go up to this first line. On the guided platform, this little mouse-looking device, you see that? This is the micro blade. It's like a reciprocating blade, and it has this little notch here that actually will go into the track. So you want to make sure that you keep it in the track. Go ahead, and I'm going to put the suction on and put it in the track. And I'm going to advance my blade. Did you feel that one? I'm sorry. Do you feel it now? Okay. And I'm going to turn it on, and you're going to move the blade from left to right in the track. And then turn it off and come back to center and pull out. Now if you look, can you see that, Megan? I'm going to turn this on so you can kind of see the blade and how it works. It's hard to see, but did you see how it comes out? And then it retracts. So it's a reciprocating blade. We're just going to move along. So left, right, turn it off, and then come center. So we did these two dimples. These three I can actually do together because they fit within my teardrop. I'm going to take it up to what we call P2. So I go left, right, come back, go up to the next track, left, right, turn it off. It's really nice, this guided platform. Okay, so I have those 5 have been done. I have this one and this one left. Last one. Hooray!
Okay. I'm doing
You're
okay.
good. All right. And one thing I want to mention, when you do put your guided platform onto the tissue and then you turn on your suction, when you advance your needle, you want to make sure that you don't see any of the blade. So that would let you know that you do have good suction too. So you want your blade completely into the tissue. So now that she's done there, we can do a little what we call milking, where we just kind of help get some of the fluid out. A lot of times too, we'll have our patients turn over and just kind of rock on their buttocks to get the fluid out, because this fluid, we'll put a bandage on her, but she'll leak the fluid over the next 12 to 24 hours too. There's very little downtime with this. There's lots of bruising. You can have bruising for up to probably 3 to 4 weeks. The bottom, when people do their buttocks, seems to be a little bit more tender than the back of the thighs. So it might be a little bit sore when you sit down, when you go from sitting to standing positions. We do ask that they wear a compression garment, just like a light Spanx or biker shorts or some Under Armour, to help compress the area. And I think that makes the patient feel a bit more comfortable too. But really, she doesn't need anything for pain after this. She could take some Tylenol if she'd like to, but that's about it. You don't need to ice the area or anything like that. I do tell them avoid like soaking in the tub for at least 24 to 48 hours because the blade makes a little incision, not enough to have to do a suture or anything, but it is an open area and you're trying to prevent any type of infection. So we do a sterile technique on this. You can do it in a room. We are choosing today to do it in our spare OR room, but we have done them in the patient rooms too. Everything is set up sterilely and her bottom is scrubbed beforehand too. So what she'll do after this is flip over and we'll let her kind of rock back and forth, and then she'll turn back onto her stomach and we'll put some bandages on, and then she can get dressed. She can put her compression garments on and then go. I do encourage patients to wear black pants in case they do leak the fluid. It's a little bit, did you wear, and you wore black today.
Yeah. Oh, yeah.
Then, you know, if they leak through, you're not going to notice it as much, but you know, I don't want people to ruin their clothing. So we'll have them, we'll have her come back in probably 4 weeks to see her results. This is something that will get better as she begins to heal too. So we usually check them at 1 month, 3 months, 6 months. And also we do send them home with extra padding in case they do need to change these pads. If they're having a lot of areas worked on the thighs and the buttocks, I will recommend a crotchless undergarment just because it's a little bit easier and, you know, dealing with having to go to the bathroom, because sometimes the bandages will come off. So it's just a little bit more convenience for the patient. But really the most pain she felt was when we were numbing her. She'll be a little tender afterward and have some bruising. Tylenol will help. Some people will take Motrin, but then that can, you know, increase that risk of bruising and bleeding. Usually if somebody is taking Motrin beforehand, we'll try to ask them to stop just because of the bruising. But really it's not a procedure that requires any type of pain management afterward. So people tolerate it very well. And you can see she's got the little rings from the suction. That will go away. And this blanching here from the anesthesia will go away too as it wears off. Alright, and that's it. We'll let her roll over and then we'll get her bandaged.